How you doing, everyone? This is Kento at Kamiyama Physical Therapy. Welcome to our YouTube channel. We have been doing a webinar every week since the COVID-19 quarantine lockdown in New Jersey. So we've been doing sciatica anatomy, knees, hips. We've done shoulders as well. And this one is about ankle instability. So for those that have chronic ankle issues who may have sprained their ankle multiple times when they're in school or they're playing sports, or they have bunions, or do they have plantar fasciitis, and they have difficulty feeling stable in their ankle. If you are one of those, this webinar might be for you. We have simple things that you can take a look at to see if you can improve your ankle in a way that you may have not done before. So if you've never done or you have been stuck with your ankle and you need a little bit more information or just have a different way to look at something, take a look at this video. So hope you enjoy. See you soon. Hi, this is Kento at Kamiyama Physical Therapy. Welcome to our channel.
Get started. So welcome, guys. Thank you for coming. For those that are coming in, you should be muted as you come in, so stay muted so you don't get any interference along with that. At the end of everything, we'll get into a Q&A. So if you have any questions or further concepts you want to talk about, I'm happy to do that. I've always enjoyed that kind of stuff. So today we're going to talk about ankle instability and certain things that you may not have thought about to progress your ankles a little bit more. Along with that, I hope everyone's getting their COVID-15 on. I'm definitely getting my if you haven't heard what COVID-15 is, apparently there's a thing called freshman 15, but in the COVID version. So I'm definitely eating more. Like I don't drink coffee, but I'm drinking coffee. This is a Japanese version of coffee. Just an FYI, if you guys are not into Japanese coffee, it is amazing.
Why is it amazing? Was it amazing? Is it like a bias because you're Japanese or?
No, there's no bias at all, Danny.
Okay, sure.
I'm drinking a little bit more too, so a lot of things are changing, guys. if you all know me, I'm doing a lot of things that's different. But before that, I kind of want to talk about my dad. This is not a daddy issue thing. It's actually my father had some low back issues, like really bad. Like he's been running for a while, but the second the quarantine started to happen, his back started to hurt, and it kind of got worse. But he never asked for help. He's a stubborn guy. He's a stubborn bastard, Japanese bastard, and I probably have a couple of things around that come from him. But in the past week, he got to the point that he has really bad sciatic pain on his right leg, can't walk, and suddenly he finally calls me. He goes, "Kento, I need help." And I'm like, "What took you freaking long to ask for help? What took you so long?" So I went to go treat him. Took about 2 tries to go for it, but now he's actually walking and mowing the lawn. The cool thing is, it's hard. The thing that improved his back was his neck. When I improved his neck, back pain and shooting pain went away. It's a lucky one. It's not always kind of like that, but he started to mow the lawn and he had so much joy mowing the lawn. Like he's like, "Oh my God, mowing the lawn is so much fun right now." So one thing I want to talk about is that, during these times, it's really hard to ask for help because we're not seeing anyone else. But if you are having trouble, guys, ask for help. Ask for help. It doesn't have to be us. Just ask your friends, ask your family, ask for other people that are an expert. If you are suffering from something, make sure to ask for help. Don't wait until the quarantine is over. I totally get in person is better, but just get some from advice and expertise. So if you are going through something, and it is something that we tend to be the expert at or we're good at, like if you have ankle pain, knee pain, chronic issues, we want to help during these times. We're doing webinars right now is an excuse to kind of connect with everyone else, but also just to inform everyone else and just give whatever we can right now. So if you are going through quarantine and you're having issues, we would like to help. So we've been kind of during the webinars, we've been giving out some virtual complimentary sessions or assessment sessions out there. So if you have anyone that is suffering and you have difficulty asking for help, just like my dad did, guys, ask for help. So if you go through email info@kamiyamapt.com or call us at 201-305-9665, please feel free to comment, not comment, like connect with us. And we'll just see if we could, before we even get to a session, we'll just make sure we see that if it is something that we can help, and then we'll give you something, on us, and then go from there. At least we'll be able to guide you where you need to go from there. If you probably need furthermore, we'll obviously tell you, but ask for help, not just us, but anyone else that is practicing for you guys. So let's get started with the webinar. We're gonna talk about improved ankle stability for good. And this is something that a lot of us probably have had. I'm a soccer player, former soccer player, tennis player, so I sprained my ankle, I think at least 4 or 5 times each ankles. So the cool thing or bad thing about ankle sprain is like you can walk it off. That's what you were learned. So I walked it off many times. But the thing was like I was scared of re-injuring it again because it gets unstable. Until like I kind of understood what are the things that really helps your ankle stabilize for good. So I'm gonna go into simple stuff today that could lead to why your ankle might not be getting better yet. So a little bit about me for those that are new. My name is Kento. I am the founder of Kamiyama Physical Therapy. I have Danny here with us that is also my therapist / acupuncturist. I'm a lecturer. I'm also a teacher at Seton Hall University. So I love teaching. But another way to think about myself too is I enjoy teaching the individual very holistically. I like to look at the person as a whole. So when you come to me, I don't just look at, let's say if you come for me an ankle issue, I don't just look at the ankle. I look at how other things work together, what habits you might have, what thought process you might have to affect it. So just enjoy working the individuals holistically because it tends to get the difficult problems solved a little bit more. I love reading. I enjoy going deep into topics, but I also love spending time with my 2 kids, Mia and Kay, and my wife too. Never forget that. So if you take a look at my pictures here, my daughter is like always bothering me during my workouts. My son too, but my son's smile here was great, so just wanted to put it there. So I'm gonna hand it over to Danny in a second. Danny's gonna talk about some introductory things about ankle. Then we're gonna go into posture, some movement stuff, and we're gonna go into some show and tell, and then we'll do some Q&A. So Danny, take it over.
Thank you, Kento, for sharing the story with your father. I think I can relate to my father is the same way. Like the way that I found out something is going wrong with him or something is aching is through my mom. My mom calls me, oh, can you call your father? And I'm like, oh yeah, because he's hurting. He can't move. It's the same thing. I don't know if it's something related to old school, but I can relate, and thank you for sharing that story too. But for a little introduction about myself, my name is Danny Burbano. I'm a physical therapy assistant, also acupuncturist in New York. I'm lucky to be an adjunct professor for Seton Hall University for the anatomy program for both the PT and physician assistant program. I'm also love like problem solving, and I think that's the reason that I love fixing cars. Like this past weekend, I was just like working on the brakes and upgrading the brakes on my car. So I think I just love the problem solving and kind of finding kind of that problem, where it's hidden. And of course, I love spending time with my wife as well. But like let's enough about us. Let's get started. Like Kento was saying, like today we're gonna talk about the ankle, and of course we're gonna talk about the ankle stability. In order to understand it, we're gonna go through layers, and the layers are gonna be we're gonna go about bones, we're gonna learn about ligaments, and the muscles that are around the joint and all of that, and how it moves. Meaning there's gonna we're gonna go into the understanding the medical terms, so dorsiflexion, plantar flexion, eversion, inversion, and all of that. But we're also gonna go to something that you guys probably heard a lot of, pronation and supination, and finally understanding, so you guys can know what it is. And of course, we're gonna bring it together with a posture awareness and kind of like knowing like where you fit into all of this. So the ankle joint, you see it here. The medical term is also called talocrural joint, meaning it's gonna join this bone right here, which is highlighted in green, which is the tibia, its brother or sister, which is this bone right here, fibula, and the third bone called talus here. So this joint is gonna be a hinge joint, meaning almost like a hinge joint, almost like a door. It opens and closes. So it's only gonna mainly do one function, which is dorsiflex and plantar flex. Dorsiflex is, I'm gonna show it for you guys here. Dorsiflex is like bringing your toes or your whole foot toes up towards your nose. Plantar flex is bringing your whole foot down towards the ground. But as we know, we don't just move in one plane, right? We're multi-dimensional. We move in many, many, many ways, right? So how we get to move side to side and adapt to the environment is going to be through inversion, eversion, which is moving side to side. And that is going to come from a bit different joint in this area called subtalar joint. What happens is, as you can see, once this joint, talocrural and subtalar, comes together, they're gonna come into like giving us a three-dimensional kind of movement. Because what's happening is, since we're moving a lot, this joint would tend to be unstable, which we're gonna discuss later. But what's gonna keep that joint stable is gonna be the muscles, which the muscles are gonna start all the way up around the knee, all the way down to the top of the foot or the toes, and also the ligaments, which you can see in here. Those ligaments and those muscles, they're going to try to keep that joint in place, because as you can see here, there are a lot of bones and tiny little muscles that they all work together to try to hold the weight from above. And so you can adapt to the ground, if it's even, if it's uneven, and all of that. So let me go to the next slide so you can see more of it. So as I was saying before, the movements or the ankle are going to be dorsiflexion, which is, you can see here, bringing the toes or the whole foot up towards your nose. Bringing the whole foot down is going to be plantar flexion. Now, if you see the movement, this is a posterior view, or moving a view from the back. Eversion is going to be when the ankle, that heel part, is going to go away from the midpoint. Let me actually show it here. So if I was to draw like a midline here, like almost like a center, right? Eversion is going to be going away from the center. You can see it here. Inversion is going to be going towards the center. Now we know about dorsiflexion, plantar flexion, eversion, and inversion. So something you probably heard from before is going to be called pronation and supination. So if you go to a shoe store, if you go to like, like any online, oh, you overpronated or you oversupinated. Let's find out what it is. So let me just take this away for a minute. And I want to show you this. So if you guys know the show Tiger King, and you guys know Joe Exotic, so I wanted to like think about like if you can imagine that accent, pronation with a supination. Joe is asking what it is. What is it? Right? So let's find out. So pronation is going to be made of basically three simple things. It's going to be the heel going out, your whole foot going out, and dorsiflexion. In other words, the whole foot is going to be flat or collapsing. Now let's explain that to Joe Exotic again. What is supination? Supination is going to be the complete opposite. It's going to be the heels going in, the foot or forefoot going in, and the whole foot going down, meaning it's going to give you the arch or the heel, which I'm going to show you later. So remember, those two different things are just a combination of all of those movements. So in other words, if you see it here, again, this is the midline, right? Pronation, which is a figure on the left, is going to be the heels you see going out, the foot going out, which is going to make the whole foot flat. Supination, if you go central or mass here, supination is going to bring the heel in, bring the whole foot in, and creating the arch. So I want you to remember that, because Kento is going to bring it together towards the end when it comes to movement and when it comes to the three-dimensional kind of point of view. All right, let's get into the next slide, which is going to be, now what does that mean? Since we're moving a lot, how do we keep something stable? So all those movements, right, the dorsiflexion, pronation, supination, all of that it's going to allow us to be dynamic, meaning it's going to allow us to walk, run, jump, and all of that, and adapt to any kind of surface that we have, right? But because it's moving a lot, that joint is going to be unstable, meaning it's going to be prone to being stuck in one position, either pronated or supinated, or either one, or stiff, right? What does that mean? So when we have something that's working too much, things are going to happen, right? So any uneven distribution of forces around that ankle is going to end up having issues above, such as the knee, hip, low back, or in Kento's father, even in the neck. What does that mean? Like, so the top and the bottom communicate. The top all the way from the neck all the way to the ankle, it is in constant communication. So sometimes what happens is like you will see, or you personally feel it, or you will see like someone is completely flat-footed, meaning, I'm sorry, which is pronated, or someone has like a really, really high arch, which is over-supinated. Sometimes it will present as feeling stiffness. Sometimes it will present at an ankle sprain. So sometimes, like Kento was saying, like he had like I think 4 or 5, I think he mentioned it, but like we get a lot of patients that have like ankle sprains, like 2 or 3 per year. So imagine what that's doing to the joint and all those little ligaments or little muscles that are around the ankle. So in other words, how do we, now we know there's a communication like from the top to the bottom, but how do we know where our weight is, or center of mass, or if we're completely aligned? So one of the simple things that you can do is, since we're all sitting in front of a computer, we can try to stand up, right? So as we're standing up, for those of you who are doing it, if we're standing up now, put awareness or kind of feel your feet as you're standing up and coming back down. What do you feel? Do you feel your heels when you're standing up? Do you feel most of the weight on the front of the feet when you're standing up? Sometimes like what happens is like when things are being overused, or the weight is not properly distributed, we're going to have arch pain, or we're going to have that plantar fasciitis, or we're going to have like, that pain that's going to get worse when you're standing or walking. So in other words, it's almost like if you see at the bottom here, you see like that level. So when things are not properly level, that bubble, which is the center of mass, is going to be off. So in other words, we're going to have stress and things wearing out. So in summary, the ankle joint itself is a joint that moves a lot. It has a lot of range of motion, and it moves a lot, but it has also tiny components, tiny bones, tiny muscles that are kind of keeping up, and then kind of keeping up with the ground, but also keeping up with the weight that's above, coming from the hips, coming from the head and the rib cage and all of that, right? So we want to make sure that we look at the ankle, but we also look at the whole body, and try to determine what the center of mass is, which Kento is going to explain in a few seconds. Kento, let me take it from you from here so you can explain it to them a little bit better. Let's see here. Kento, you have the control.
I see it now.
You see it? Got it.
All right. All right, you guys should be able to see it now. So Danny, thank you. So now we're going to go into a little bit of the bigger picture stuff. Danny already started talking about it. So if any of you have actually just stood up and kind of sensed where your weight distribution is, because I want to talk about that a little bit, because the next part is going to talk about that. So if you are a person that tends to feel the balls of your feet a little bit more, or if you're a person that feels the heels a little bit more, right? So when you are standing, you just need to be aware if you're being on the outside of the foot a little bit, inside of the foot a little bit, front of the foot a little bit, or back of the foot. What I'm going to talk about now is, what does that mean? A simple thing, we're going to talk about a person that has the weight on the balls of their feet. What that also means is the weight distribution is going to be in front. So I'm going to do a little drawing here, because Danny did that and it was really helpful. So we're going to take a look at this guy first. So let's say this guy's a good posture on all the way to the left. If you take a look at the red line that he has, the weight distribution is around the heel. If it's an individual that goes around the front or the ball of the feet, and I'm going to go to the next guy here now, right here, right? We're putting weight more towards the balls of the feet. That also means your center of gravity has a tendency to be a little more forward than usual. Another way to put that is you are falling forward. And when you're falling forward, or the sensation of falling forward is there, even if it's a little bit, this brain here goes, oh, I'm going to fall forward. I got to figure out how to stand back up straight so I don't fall. So to do so, for some people, they're going to start arching their back in order to bring their upper body back so they can balance and stand tall without actually falling. The reason why I'm talking about this for individuals that have done chronic ankle sprains, Achilles tendonitis, plantar fascia that's very like chronic in nature, or you have ankle foot issues on a fairly consistent basis, there might be a reason why your ankle itself is not getting better because something else up the chain has compensated to help your ankle out, not in a good way. So for individuals that had flat feet and they do as much arching drills, like let's say you went to a podiatrist or another therapist or whoever, and you did arching drills and you did a bunch of arching drills, but it doesn't progress. You've done a good job by doing arching, but it never progressed. And you ask yourself why, or I would ask myself why. And it could be because the person did not address something in the low back or something in the hip or your neck. Because something is not relating to each other. They're not integrated. They're not coordinating together well. That's one way to think about it. Now, for example, let's say your weight is on your heel all the time in a dysfunctional way. If you do it like on the guy over here, you're doing a probably pretty good job. But let's say you're a guy that has most of the weight on your heel, but not in a good way. If you see the guy, and this guy's obviously acting, but let's say he brings their head back, or they kind of slump their upper body so much that everything goes backward here. What this guy may have is like a heel pain, but also if you take a look, his knee right here gets a lot of the brunt because he's holding the heel together and the body's going backwards, but something has to keep him forward. In his case, in this guy's case, the knee is getting a lot of forces and he doesn't like it. Right? So the reason I'm talking about these things is these are just ideas of how not just the ankle, but things above the chain could affect your everyday life when it comes to the ankle. Right? I hope this kind of makes sense. Right? So I'm going to go to the next one. So now we're going to go into some kind of videos so I can show you. It's just easier to show this way. I would love to just use other people's videos, but we're all quarantined, so I just have to videotape myself. And Danny says videotaping myself could improve my, my narcissistic qualities. So if I become a little more narcissistic than usual, I'm gonna thank quarantine for that.
It's all about you, Kento, always.
That's right. Yeah, I'm starting to notice, Danny. Starting to notice. But anyway, coming back seriously, this is a quick video. My son's in it, so ignore my son, right? And just watch where I'm gonna go through here. So give us a second, internet, there you go. So that's my son just loving the camera. So here, hold on, there you go. So this is a spot where I'm doing kind of like a single leg balancing exercise. And I'm seeing if there you go. So I'm doing a single leg balancing exercise. And if the individuals so let's say sorry, excuse me, I was just looking at a quick chat there. When an individual doing the single leg exercise, this is a great way to know where the individual is focusing or balancing on. So in the physical therapy world, when you talk about balancing strategies, there's different strategies. They say there's an ankle strategy, there's a knee strategy, there's a hip strategy, there's a trunk strategy. When I see an individual start to have chronic ankle issues that can't get looser or whatever it is, they start to become tight in their neck, shoulder, or their trunk. So when I'm looking at here, whenever you have balancing stuff, so I think you might want to practice this once you're done here. And let's say you're doing a single leg exercise. And whenever you lose your balance, notice if your balance gets lost because your upper body shakes a whole lot. So if you take a look at me here, my knee and my foot kind of staying here, but my upper body or my neck is leaning to the right a whole lot. And in this part of the video, I am wobbling a whole lot up here. And I'm trying to balance through my head, shoulder, and my back. That's not necessarily a good thing because that's what I'm trying to balance, even though my foot is the thing that's on the ground that should be the one that's helping me regulate everything else. Okay? So very commonly, when I see individuals that have chronic ankle issues, they will use that area often to balance. So what we're looking for as a result is I'm doing sign language here, and is to relax the upper body. So the upper body is the neck, shoulder, and upper body or back tends to be fairly relaxed. And what you're going to allow yourself to do is to wobble the ankle. And probably because of that, a little bit in the knee. What that does is you allow your ankle and knee to connect to this thing called the vestibular system, which is the inner ear system, and integrate that information together. That's a very important thing to understand. So a lot of people that have ankle issues, they forget how to wobble. And what often for whatever reason, we think it's like, oh my God, my ankle is wobbling. That's probably a good thing. I'm losing a lot of balance. But it's actually part of the progress and the process. So relax your upper body, relax your neck, and try to do some single leg exercises. And if you see or feel how your ankle adapts and wobbles, that's the ankle adapting along with your balance system. That is going to lead to progress. I hope that makes sense. So I'm going to keep actually playing the video so you have an idea what we're talking about here. So if you see, I don't know if you can see the video quality on this because I know it's not the best, but if you take a look, ignore my sign again, my ankle and knee is the one that's wobbling, but my upper body is just going down to the ground and letting my legs do the work. This is part of the things that could be very helpful. Now we're going to go back. I hope that kind of made sense, or at least kind of sparked some interest here. The next one we're going to talk about is ankle pronation and supination. And I'm just going to explain it in visual terms what ankle pronation looks like and ankle supination looks like. So the first part of the video is going to involve ankle supination. That is when you arch the foot. Okay, so I just arched the foot. Hold on. Excuse me there. I just arched the foot in this drill. And what's important to understand, and what Danny said very nicely, is the foot is a three-dimensional body part. Everything really is, but foot really is three-dimensional. So when you create an arch, if you're thinking one dimension where you're like, okay, let me bring the front part of the foot and back part of the foot together and arch, you are probably not making the foot or doing the arch justice because you're not allowing a three-dimensional motion to it. So when I think about a three-dimensional motion, I allow a spiraling action to happen. So when you do have an arch, what you also want is the shin bone also turning outwards along with that. And when you do that, you allow things to also go all the way up to your hips and your core. It's the same thing when it comes to pronation as well. Oops, hold on. There you go. So when you supinate, your calves are on, like that's what I'm saying in my video. And then we're going to go into ankle pronation in a second. So when you pronate the ankle, the foot flattens. And the tibia or the shin bone goes inwards now. So if you see how my foot get flat, and the shin bone is now going inwards, kind of like in a downward spiral. Oh God, I'm the worst spiraling person here. But anyway, so don't spiral like the arrow that I just drew, but you get the point. It's spiraling down towards your inside heel and arch. The important part to understand there is the reason why you flatten the foot, and this is just one reasoning, is you have an arch, which is kind of like a dome-shaped thing, and when you flatten the arch, your connective tissue stretches out and creates this elastic coil. So imagine a rubber band starting to stretch. Hopefully from there, you uncoil and everything will go back up, right? So that's the key point to that. Now, if you're a person that goes, oh, well, Kento, I have high arches and I have difficulty pronating my foot. Like it's hard for me to flatten my foot. I'm going to talk about a reasoning why. So just give a second for the video. So I should have not wore jeans when I'm taking the video, but this part, why I'm showing this is the importance of the hip integration or the core integration. Your foot, when it flattens, that's when it creates a little bit of instability, meaning it becomes more mobile. When your foot flattens, your bones in your feet starts to become a little more mobile and it has more adaptability. It's a very, very good thing to have. For some people, they're too flat, so they need to arch, but I'm talking about people that have difficulty actually creating a pronation. One of the reasons why you may not be actually pronating very well is because you don't have support elsewhere in the body. So if you take a look here, my hip on the right side is jutting out a little bit. By allowing my hip to jut out to the right a little bit, I am stabilizing or loading into my hip. When my hip loads, my brain says, I have some form of support somewhere else in my body. Okay, let me start loading and putting weight into my foot. But if it is not, your brain's always going to care about survival. So for some people, they're going to arch the crap out because he's like, I'm not safe because something else up in my body is not supporting me. So I'm going to supinate or arch the crap out of my foot so I stay safe. So it's this relationship that goes on with this. So if you want your ankle to relax, you kind of want your hip or something else to involve, because your foot bones, if you think about how big it is, it's not so big compared to your whole body. So I don't care how many arching exercise or pronation exercise you do, if you don't involve the hip or integrate the hip or back or muscle like core, it will be difficult to progress. That is my theory and philosophy on that too. Okay, so hope these are kind of giving some ideas on it. Okay. So I hope I kind of went off on it for a second, but I hope I gave you guys some ideas with it. This is a time for Q&A. So for those that are interested or just want to talk, this is the time. This is kind of like my favorite time too. So if you guys are here for the first time or you want to ask questions, I would love to see your faces. You're not obligated to show your faces, but if you are ready to ask questions, either put it in the chat or unmute yourself and ask questions. So anything ankle or I don't know, you can talk about the, if you don't like Japanese coffee and you feel like Dunkin' coffee more, like we can talk about that too. Does anyone have any questions?
I have a question.
Go ahead, Paul. Thanks for coming.
My pleasure. Can you talk about like muscle versus fascia and producing force in the foot or recycling energy, absorbing things and stuff like that? Like the role of the muscle versus the fascia.
Oh, that's a great question. It's a great question. So I'll try to simplify it the best I can. So if you've gone through some of the fascia research, and I'm not the expert in fascia, but I'm going to talk about what I know about fascia, you need a whole lot of tensile force to create change in fascia. So there's a whole lot of elasticity, like strength and elasticity in the fascia. So, and the muscle, like a fascia surrounds the fascia, right? So they both kind of are in relationship with each other. What a muscle does by contracting or lengthening, it regulates the fascia. So it gives power to the fascia depending on how much you want to contract or let it go, right? So let's say, for example, A great example is the fascia in the back. So like you're just like right under the low back area, above the low back area. That's called the thoracolumbar fascia. It's a really strong area. It takes about 20,000 pounds to do anything to that if you were going to work on it. So if you let muscles around that area, let's say your oblique muscles or whatever, actually work and regulate the fascia, right? So you use muscle to kind of stretch the fascia. That helps you utilize the fascia better, right? So fascia is kind of something that is there, right? That you can, but it's kind of, it's not going to work on its own. The muscle is the regulators. Like it's on the regular, like meaning like it's the on-off button, but volume. It's like, oh, if I contract this muscle much, that fascia around here is going to get more and more connected or stretched out to create the elasticity. The more you don't use it, not going to happen.
Kento, let me add something. Great question, Paul. Almost like, if you want to think about it this way, like if you wanna, the simple thing, right? If you want to do like a bicep curl, right, and you want to develop strength in the biceps, you're not gonna develop any strength just by doing curls without any weight, right? If you want to get it to be stronger or develop power, you're gonna put weight on it or tension, right? Same thing goes in the feet, like Kento was saying, like, there's so many those muscles in there in that fascia, like you asked, they need to get that tension or that weight in order for them to build strong. Because you can do all day long, you can do the arch, you can bring the toes and against the heel, you can bring it together. But that's just almost like doing a bicep curl without any weight, right? If you want to develop strength and you want to be able to lift a heavy box, you want to build tension. You build tension by putting weight and integrating the tissues or the joints above, just like the hip, right? Integrating that core. So there's a communication between top and bottom, so the brain can accept that information too. Hopefully that can help.
Makes sense. Thanks for clarifying and expounding.
Anyone else?
I have a question. Hi, Kento.
Hi, Romina. How's it going?
Good. So I was wondering with, let's say someone's coming off of an ankle injury or even like years after, they're fine, they're cleared for exercise, but you can tell it's still unstable. And there's progressions of like how challenging the exercises can become to kind of keep rehabbing even from a fitness perspective. How would you know when that person's ready to progress from, like, say, isometric holds in a 4-foot position with the heel elevated or just standing on the leg, and then when would they be ready to go into something like plyometric? Like, what's the indicator that that person's ready to progress?
Got it. So I'm going to repeat the question so I understood it.
Yeah.
Like your intention of it. So let's say for example, what you're saying is, let's say the person had a foot issue or an Achilles issue, and you did in the beginning to rehab, you did kind of like isometrics or something that's less bouncy, like let's not as plyometrics. So what would be some indicators that says, hey, when am I allowed to progress into plyometrics, or like what would be the progress? Like how would you progress in general?
Yeah. Like the continuum of like, okay, you're already really good at the static stuff. You're already good at these different position holds. I think you're ready to do something more dynamic. Like, what would indicate that next step?
There's a lot of factors to that for sure. But if it is isometrics in the beginning, and let's say it's a calf issue for the most part, then I would just go into, let's say you just did isometric, then dynamic stuff would be like a slow tempo would be the next progression, I would say. So you might do like a slow squat tempo eccentrically, so you can actually go into that position a little bit more. And then you'll just progress into kind of weights and then progress to plyos. I don't know if that's what you're asking, like, but
yeah, I mean, it's a general question. I'm sure everyone's going to have a different version of their own continuums, but it's more like I'm asking, how would you know when a person is ready? As general as that is.
Yeah, that's a hard one. That's a hard one. I wouldn't know. I think I would just kind of be in a position where you have your own next progressive exercise, right? And if you feel like that's too much of a jump for the individual, you just got to find something middle. And if they get good at that, you almost like risk and try it out. I wouldn't know. I would have my own progressions of what you are looking for the person. And kind of break down those different variables and then bring it up from there.
Mm-hmm.
Yeah, I think we'll have to I mean, I think we're talking later, so we can talk about that more in specificity later on if you don't mind.
Yeah, sure.
Anyone else have questions? Did someone put in something chat? I have someone say, oh,
A question.
hi, Andy.
So I've got a pair of arthritic hips. So I've definitely got some up-chain issues. I'm doing what I can to maintain flexibility and strength in the hips there. But then a few months ago, I developed Achilles tendonitis, and that's nagging. I'm really having trouble with that. So do I have to wait to get new hips to try to solve that?
It's a great question. These are very specific and it's good.
Well,
Assuming I've never assessed you or seen you before, so I can't say the severity of your hips.
mm-hmm.
What I would do before you wait for any total hips or any new hips,
Mm-hmm.
I would try to see what it is that's relating, how your hips and your ankle are relating to each other, because there's a good chance that those are both related. So let's say your hips are arthritic and you can't, I don't know, extend your hip very well.
Mm-hmm.
What that would lead to, meaning when I say extend, like you can't kick it back when you're walking,
Mm-hmm.
what that would lead to is an ankle that doesn't get to the end range of a certain position. So you won't stretch your Achilles as much, right? So when that happens, eventually what happens is that Achilles get tighter. And when you accumulate that enough, eventually, let's say when you have to go up a stair that you need to put a lot more yourself into an Achilles stretching position, it goes like, oh, I'm not ready for it, and it goes through some form of inflammation or something that happens.
Mm-hmm.
So I don't think it's, Andy, I don't think it's too late, if that is the question. I would actually start the best you can, work from there.
Mm-hmm. Okay, thanks.
You're welcome. I think Nicole asked a question saying, to get permission to move into active pronation, we need to do something like load the hip to create the stability higher up to grant that. If they can't come into active supination, do we load in the same way? Well, these are good questions. It's going to be hard to answer these questions in short times. Kind of, yes. So the difference between the two, if I can explain it, Nicole, if you're still on the call, is when you go into pronation, the feeling of it is kind of like a top-down sensation. So your hip going outwards a little bit is going to help you get into ankle pronation. When you supinate, your hip is going to be kind of in the best way staying in that spot as you supinate. So what you're trying to do now is from the bottom up, you're trying to connect to the hip muscle. So if you allow yourself to be in that hip position that I showed in the video and you try to supinate, say, arching the foot, you will likely feel how that supination drives up into the hip and feel certain muscles in that area. So yes, I would probably be in a similar position and you try to supinate, and then you might feel certain things. If you supinate and you kind of lean your back that way, then you're probably not doing it well. You got to feel that load. So I hope that answered that question. If anyone else has other question, oh great, thank you, Nicole. Preston, I see for daily shoe wear, do we aim for the shoes with a minimalistic insole for us to deal with our foot issues with exercises rather than some fancy insole? What do we look for in a walk around shoe? I'm not sure if I understood that. So the first question here, it all depends. So if I'm being honest about myself, I used to be like a barefoot guy. So I was always going to be like, okay, everyone should do boot barefoot. Right. And I still want people to be barefoot, if I'm being honest, like as an end game type of thing, because I think we still need to be able to like control or adapt to the environment that's already there. However, for those individuals that do not have good active control, having some support to help you feel certain things is not a bad idea. So for example, I think you might do that, Preston, is like the squat example is a great one. When you're squatting, and let's say the person does not know how to get down into a deep part of the squat and just needs to, and you're not looking for the ankle issue, you're just looking for their upper body and hip to work well, then you go into like a heel raised position to allow that to happen, right? You're doing that to help them understand or learn that position or movement somewhat. So the foot's no different. Let's say the individual has a high arch, very high arch, and they can't pronate. Sometimes bringing the ground a little closer to them, in a sense, an arch support, and then saying, hey, can you feel the arch? Great. Can you feel that and go into the hip? Is a great starting point, right? But as a progression, I'm going to take it away. But as a need for those moments, I may use it. Does that help? Is this on a answer the question?
That was perfect. And I should have reread what I wrote, but basically, are there any guidelines for a shoe that you're just walking around working with that you're looking for, or is it just very individual?
It is kind of individual, but if I'm a great resource for this, if you guys are into Posture Restoration Institute, they have a pretty good guideline. If you go into PRI shoe guidelines online, the simple thing I tend to look at is when you bend the shoe, for people that are, when I'm saying that is when the person's not doing barefoot sneakers, minimalist sneakers, this is what I would look for a person. Is when you bend the shoe, it bends by the toes. Because some shoes bend at the middle, right, where you don't really want to bend. Like if you actually look at like bad rheumatoid arthritis or arthritic foot, they bend at the middle. Like that's not a good sign. It doesn't bend at your toes anymore. So the bending of the toe, the heel, so the back heel support is nice and stiff. It's because when you actually get that heel contact when you're walking, the shoe is nice and like snug on the heel, so it doesn't move, right? For shoes that are very kind of like very floppy in the back of the heel, they don't have stability, so you might move a lot in the shoe because of that. So because of that, their sensory system or balance systems gets a little bit more in a survival state. Last one is, I think when you actually look at the back of the shoe, make sure the cushions are symmetrical. It's not one is higher than the other. You'll be surprised when you take a look at it, and some are like this and some are like this. And even if it's a new one, it's just a manufacturing error sometimes. You just got to take a look at it, because I'm sure any one of you here, when they are walking and you compare your shoes and you look the under and like, oh my God, my outside heels like worn off so much compared to my inside heels. And imagine you wear a shoe that's like this even more, you just made your dysfunction worse. So having something that's more like when you look at the back of the shoe than neutral is probably a good call. Good? Excellent. Anything else? Paul, it says hallux valgus, please, is not a question, my friend. You need to go a little further than that.
I guess like the main driver, what would cause, if you can kind of generalize, like the main driver of hallux valgus.
Fine.
Or whatever, if there's a such thing.
Fine. I'll do my best. So I'm going to get up in a second, but so hallux valgus, for those that are not aware of the term, it's a bunion. So I'll talk about a quick bunion example. Give me 1 second. So give me a thumbs up if you guys can still hear me. Oh, everyone at the same, that felt kind of good. All right. So if you take a look at the foot, so I'm going to give one quick example. Very commonly, a bunion is very commonly, it's not the only way, is when the foot flattens in a dysfunctional way. So for example, I'm putting my weight into the foot and the person's like, let's say the person's toes pushed out a little bit, like toes out. And let's say I'm walking and I'm pushing, like I'm walking like this. My body keeps going forward, so I'm going to flatten my foot. And because my foot is not straight, what happens is I start to push my toe out that way. as I walk and then come out in here. So there's this pushing that way force that's happening when they are walking and going through the toes. So because they're not straight through the toes, they never extend the toes, but instead they go like this and then extend the toes. That is a common gait dysfunction that leads to a lot of bunions type of position. And a lot of people with bunions, right? The first good thing to do is like spread the toes, right? That's not a bad thing to do. However, like it's the same thing with the ankle stuff we talk about. If you're not looking at the hip and knees along with it to allow that toes to be just a little bit more straight so you don't affect the valgus position all the time, that's hard to fix. So that's why like bunionectomies are very common to do. Like they just surgically put it that way so the bunion gets better, but everything else is still not better.
Sometimes we also see that like after a bunionectomy, after a few years, the toes goes out all over again. So it's not common. So just like Kento said, like, you know, just because you fix it, you just fix it there, you fix a symptom, but you not fix the cause. You have to look at the whole body, because we've seen a lot of patients, like I said, like, you know, after a few years, the toes goes out again and right back to a revision.
Makes a lot of sense. Thanks.
Great. You guys got about 7 minutes. 7 minutes. What else do you guys want to ask? If you guys have anything. Did I miss anyone? Preston, Nicole, Paul. Does anyone else have any questions? I think we're good. I think you're good. So if you guys don't have any questions, it was great to see you all. I hope this was kind of pretty smooth. I think we're getting used to it. Give us some feedback as well. Some people have given us some nice constructive criticism and positive feedback, which has been actually helping. You know, we're not the most technology savvy people. I definitely am learning hard as we go. So this has been good. So if you guys don't have any questions, we will be doing another one again. We're just doing this weekly. So I'm not sure what to do next. We might have a guest lecturer or guest speaker talking a little bit more about the brain a little bit more, along with what's going on with our body. But if not, are you guys interested in necks, backs? Like, is there anyone that have any interest in what you guys want to learn? We've done a lot already. Paul says neck. Neck for sure. Okay, neck. Whoa.
Wrists and like why people get stuck.
Okay.
And it hurts them to be on their hands.
So I got neck and wrist for the next 2 weeks, so that's excellent. Oh, good. Neck. Who's the guest speaker? He hasn't said yes yet, so it's a he, but he hasn't said yes yet, so I can't say it yet, Preston.
Working on it.
Someone said, oh, we have one more question. Nicole, you discussed the tibia rotation. If it isn't moving in with pronation and out in supination, how do you address that? It's a great question. So this will be the last one. So who's it? Someone's back or out. So when you arch your feet, the shin bone is supposed to kind of spiral outwards. And when you pronate your feet, the shin bone is supposed to go inwards. So if that doesn't happen, how would I address that? I mean, that's a loaded question. Oh, Marlon says it. Respiration, how it relates. Okay, you guys are good, so that's great. I have more things to talk about. So when that's not addressed, first and foremost, the important thing is that you guys, Nicole said it great, to actually see that first. So a lot of people that has knee issues, you'll be surprised, and I know a couple people here, we've had that issue, where when you bend the knee and the knee hurts more, and possibly is because you couldn't pronate when the knee bends and the tibia or the shin bone didn't intern rotate, right? The reason why that's important is when you bend your knee, your tibia rotates inwards. So imagine during a squat, when your tibia goes, like when your knee bends and your tibia goes outwards, you're going against regular mechanics. So guess what? It is gonna hurt the brain here. It's gonna hurt. Honestly, Nicole, how would I address that really depends on how the individual
processes in there. So in the beginning, what I might just do is rotate, like put my hand there, and as they bend the knee, I say, hey, let that tibia go inwards, right? Outwards is a little different story. That means when they arch, they're just not including the muscle that is going up towards the tibia. Basically mean the posterior tibialis is not working along with it. So they're not actually rotating through the shin bone, right? So you're not feeling the actual arch muscle that is the most strongest. They're probably feeling like the toe muscles, right? So, that'll be much more like a clinical thing that I have to show you for people that don't. Yeah, Dino, I've talked to him already. He said he will. I'm just making sure he might, I don't know how far off the deep end he might go. So he said yes. I'm just making sure we will kind of be tamed during these times. Okay. Guys, thank you so much for coming. Just watch out for the emails. We will do one next week. We will do the neck next week. Probably the week after that is the wrist. And however long this quarantine will keep going. So right now I'm still going. So we'll see. We'll see. So thanks for coming, guys. We'll see you next time.
Thank you, guys.
Thanks, Danny.
Thanks for watching this video. If you found that helpful, and if you now are thinking that I wonder what else this person can help me with, please go to our website at www.kamiyamapt.com and find other free contents or apply to our free discovery visits to further see if we can help you. For any further information, please email us at info@kamiyamapt.com. Thank you so much.